we talk about the utility of the product packaging, utilizing color schemes, for example, knowing the patient's overwhelmed after you differential diagnosis, tell them what they have, blow up what they're currently using from a regimen standpoint. We want to make it easy. And that was the derm said, let's make you make moisturizers blue, make cleansers green. So we can say, hey, get the green CeraVe cleanser in the blue tub
Yeah.
by CeraVe. It
I
made it
still
very
talk
easy.
about that. Yeah.
Yeah. From a patient, compliance standpoint, making sure they, fulfill what you want from them. The other thing is when you're developing products, you got to make a few bets, and there's a few decisions you can make. We spend all of our effort, meaning capital, on the actual juice itself and not the packaging. There
Mm.
are other brands out there that will have fancy, cute packaging, interesting. And that's one way to obviously go about marketing product and developing. To me, what we want to do is make sure that the juice was the most impactful, because ultimately that's what stays on the skin. It's not the package itself that just sits
Yeah.
on the shelf.
Yeah. There's no doubt the packaging is pretty clinical. The label is pretty clinical. I mean, it screams out like, hey, this is to be used and not to be looked at.
Yeah.
Where I feel like some of the skincare creams out there, especially prestige, or
Yeah.
professionally dispensed, there's you wonder how much is going towards the bottle
Yeah, I
versus
mean, it's not a it's not a criticism. Well, and honestly, but most of those products will be more expensive too. So
yeah,
I'm not saying that the juice in those products
is
are
any
any
worse, right?
less watered down. That's
Yeah.
not the case. It's just
Yeah.
like they're charging more money for the complete story. For us, we're thinking about the patient and somebody suffering from a chronic skin condition, because the way we've got activated from day one and still do today is through the physician recommendations. And these are chronic conditions.
Yeah.
So it's more important for us to offer 16 ounces of a moisturizer for atopic dermatitis than it would be 4 ounces plus nicer packaging.
Yeah.
Does that make
Well,
sense?
yeah, no, no, it makes total sense. So just walking through this history, so three products were launched,
Yep.
really got a foothold in the derm community. I remember that for sure.
Yep.
And then I'm sure at some point you guys thought, okay, we need to expand, and
Hmm.
you went condition based at some point. I know there's an acne line,
Yeah.
there's obviously
Yeah.
psoriasis line, and eczema as you talked about. What was the first kind of derm condition that you decided to focus on? Was it acne?
I mean, where we actually put the disease itself was
Yeah,
probably psoriasis. If you remember, the
psoriasis.
psoriasis
Okay, yeah,
line
the red lip.
predated
Yeah.
acne a little bit.
Okay.
But
Okay.
you talked about how do we fit into the armamentarium of treatment, right?
Yeah.
Products 4, 5, and 6 basically all launched around the same time.
Okay.
And that was foaming facial cleanser,
Oh.
CeraVe AM and PM.
Ah. Okay.
Those three coincided with a product launch of a prescription product called Atrilin. You remember that? It was
Yes.
a
Oh yeah, I remember
0.05%
Atrilin.
tretinoin and
Yeah.
clindam, had the fish collagen in it to help
Hmm.
drive a little bit more of an efficacy. Really a
Yeah.
beautiful product developed by Dow Pharma
Yep.
and some of that other great formulation people. But so it goes again to like, all right, what, especially in the early days when we develop product, it's what's the relationship of that to the prescription pad.
Yeah.
And we saw an opportunity to develop a moisturizing, hydrating, foaming product that removes surface oil, makeup, dirt, all that stuff, prep for Atrilin or whatever retinoid or combo therapy you want to use after that from a topical standpoint. And then going back to the utility of trying to help patients treat their skin and drive a regimen and like reduce or dumb it down, if you will, so everyone can understand how to use these products properly. I think we were the first to like put an AM, for example, and utilize the PM to really denote morning moisturizer and night moisturizer, right? So again, some
Yeah.
other brands are utilizing that approach today, and that's fine, and I get it because we're all trying to drive patient compliance. But those kind of products 4, 5, and 6, as we talk about indication driven,
Yeah.
was absolutely at the same time that we were launching prescription medication to treat that same patient.